This video you gotta sit here and watch, because baby, this video is one for the books. It is about cultural competency versus cultural humility. What? You know what that is? Okay, stay tuned. I got you. Cultural competency is a set of congruent behaviors, attitudes, beliefs, and policies that come together in a system or among professionals that enables effective work in cross-cultural situations. Go ahead and hit that subscribe button, hit that like, hit the notification bell. You rock with me, right? Let's keep this thing going. In short, culture refers to integrated patterns of human behavior that includes language, communication, values, beliefs, thoughts, sometimes institutions of race, ethnicity, and religious or social groups. On the other hand, competence implies that you have the capability to function effectively in said task, project, etc. Then you have cultural humility. Cultural humility, the individual not only learns about another person's culture, but you as the individual starts with an examination of yourself, your own cultural identities, beliefs, and behaviors. Just think about it like this. So cultural competency, you can think of it as something that can be found or learned from a textbook. Think of the policies and procedures and things that you have in place at your job. If you're working in a hospital or a facility, there are things in place to help bring together the different cultural identities that make up your facility or your organization. If you are someone who is certified in diversity, equity, and inclusion, then you may think your certification is the end-all be-all and that you truly understand someone's culture and beliefs based on what a certification or a question on exam says. Your particular knowledge may not take precedent over how that particular patient may feel. For instance, if you have a patient who is Spanish and they refuse pain medication, you might assume they're refusing pain medication because all Spanish moms have babies. Maybe she really does have pain issues, but she might be too afraid to ask because of the language barrier. Just keep in mind, your certification does not take precedent over someone's own lived life experiences. I've been reading upon two doctors that created the term or coined the term cultural humility back in 1998. I'm going to get their names right, so I'm going to look down. Her name is Dr. Melanie Tervalon and Dr. Jan Marie Garcia. They both worked at the Children's Hospital. I forget which city exactly, but I think it was up north. But they coined this term back in 1998, cultural humility. Now, since then, it kind of has spiraled and grown into something that's probably bigger than what they expected. But I want to take it back to the basics so that you understand what the original meaning of cultural humility was back in 1998. It seeks to challenge those power imbalances. You want to recognize that everyone is their own complex, multidimensional being who brings to the table their own experiences, culture, and heritage. You want to have equity, equality, because those are two different things. You want to have inclusivity as well. Diversity is, you can't get away from diversity. Everyone is different. It's a sense of equity and equality that we are trying to bring forward. Now, as a nurse, I work in a hospital. I need to hold my hospital accountable for being non-inclusive or inclusive, having diversity, equity, inclusion training or classes, or being or just having this information readily available. And I realized that cultural humility is lifelong learning. It is critical self-reflection, critical self-evaluation, holding others accountable. So if you're in a room and someone is saying something that's untoward towards another individual, it behooves you to speak up. Of course, you want to be professional, especially if you are at a work event or at work in the facility. But you want to be able to hold your peers accountable and allow the person who's on the receiving end of that foolishness be cared for. Have you Do you understand what they could potentially be going through? Do you feel any empathy, or do you care about the effects that someone's words or behaviors may have on this subgroup of people? Cultural humility is about increasing patient outcomes, making it better for not just the hospital, but for the patients, because that's what we're there for. We are there to take care of patients, hands down, bar none. If we don't have patients in our facilities, we can't do our job. Why are we even there? We have to be able to completely care for the total person, not just that particular wound they may have on their foot or their arm, not just that incision. We have to care for that patient completely and wholly, and understand their values, implement their cultural beliefs into their care plan. Many people don't do this. Many people think that you just go in, check a box, but no, you need to have a clear, well-rounded care plan for your patient. And I can go as far as to say their family members as well, because where I am, we like to include our family members into the care plan and the education portion as well for our patients. So that's a little something that we do. I'm going to end this video with this staircase or stacked step or tiered step that I read about cultural humility versus cultural competence. So first, you have to be aware. You got to be aware of this. Second, you got to be sensitive to it. Okay? Sensitivity is key. You have to be competent. And then last, to have humility. Acceptance, sensitivity, competence, and humility. So I implore everyone to check your emotions at the door every day for each patient. Do not allow your small thinking or your ignorance, because that is what it would be, your ignorance to someone's culture, affect the way you provide care to that patient. Thumbs up this video if you found this content valuable. Please hit the subscribe button. I would love to continue to make videos on all things nursing. And if you are a new nurse, please go to my website, ifrn.org. I have 2 downloadable PDFs that has the resources in there for nurses who are starting into a new program or who are still in nursing school. Go ahead and go over to my website, ifrn.org, if you want to download 2 PDFs for new nurses. It has great information in there, some really cool resources. Please go ahead over there, check it out, and let me know what you think in the comments.